Does the efficacy of clopidogrel change with genotype? Yes, the efficacy of clopidogrel is highly dependent on genotype, specifically regarding the CYP2C19 gene. Because clopidogrel is a thienopyridine prodrug, it requires a two-step hepatic biotransformation to become its active thiol metabolite, which then irreversibly binds to the platelet P2Y12 receptor. The CYP2C19 enzyme is the primary catalyst for both these critical metabolic steps. Genetic polymorphisms in the CYP2C19 gene dictate the liver's ability to generate the active metabolite. The alleles are generally categorized into wild type, that is normal, loss of function, and gain of function. CYP2C19*1, the wild type allele, normal enzymatic function. CYP2C19*2 and 3, the most common loss of function alleles. The *2 allele is common across most populations, while *3 is seen frequently in Asian demographics. CYP2C19*17 is a gain of function allele that leads to increased transcription and ultra-rapid metabolism. Carriers of loss of function alleles, that is intermediate and poor metabolizers, experience high on-treatment platelet reactivity when given standard dose of clopidogrel, making them clinically resistant to the drug. The impact of genotype is most pronounced in high-risk scenarios, particularly for patients undergoing percutaneous coronary intervention for acute coronary syndrome. Patients with 1 or 2 loss of function alleles who are treated with clopidogrel post-PCI have a significantly increased risk of major adverse cardiovascular events. Most critically, they have a demonstrably higher rate of stent thrombosis compared to normal metabolizers. The Clinical Pharmacogenetics Implementation Consortium provides explicit guidance regarding clopidogrel use based on CYP2C19 genotype. Poor and intermediate metabolizers. Guidelines strongly recommend utilizing an alternative P2Y12 inhibitor, specifically prasugrel or ticagrelor. These agents are either less dependent, that is prasugrel, or entirely independent, ticagrelor, which is active as administered, of CYP2C19 metabolism. Ultra-rapid metabolizers, they are the gain of function carriers. These patients form abundant active metabolite. While they receive excellent ischemic protection, they may face an increased risk of bleeding. Standard dosing is generally maintained, but bleeding risk must be monitored. While routine universal CYP2C19 genotyping is not standard across all practices, genotype-guided P2Y12 de-escalation strategies, as explored in trials like Taylor PCI and Popular Genetics, are increasingly utilized to optimize the balance between ischemic and bleeding risks after PCI. Taylor PCI and Popular Genetics are the two landmark trials which serve as the foundational pillars for genotype-guided antiplatelet therapy in modern cardiology. They elegantly represent two sides of the same precision medicine coin. Taylor PCI explored an escalation strategy related to a clopidogrel standard, while Popular Genetics explored a de-escalation strategy relative to a potent P2Y12 standard. Taylor PCI trial investigated whether identifying CYP2C19 loss of function carriers and escalating them to ticagrelor would improve outcomes compared to standard universal clopidogrel therapy. The study population comprised of over 5,000 patients with acute coronary syndrome or stable CAD undergoing PCI. Design: genotype-guided arm, point of care testing was performed. Patients with CYP2C19 LOF alleles, that is *2 or *3, received ticagrelor. Wild-type patients received clopidogrel. Control arm, standard care with universal clopidogrel for all patients. genotype blinded for 1 year. Primary endpoint evaluated was 1 year MACE, that is cardiovascular death, myocardial infarction, stroke, stent thrombosis or severe recurrent ischemia. The Taylor PCI trial technically missed its primary endpoint for statistical significance at 1 year. The genotype guided strategy showed a 34% reduction in MACE among loss of function carriers, but the p-value was borderline. A pre-specified analysis looking at the first 3 months post-PCI, the period of highest thrombotic risk, showed a highly significant 79% reduction in adverse events for the genotype guided group. While strictly a negative trial at 1 year, the strong trend and early benefit heavily support the biological premise of genotyping. Popular genetics trial. Because potent P2Y12 inhibitors, ticagrelor and prasugrel, reduce ischemic events but significantly increase bleeding risk, this trial sought to safely step down therapy for patients without loss of function alleles. The study population comprised of almost 2,500 patients with ST elevation myocardial infarction undergoing primary PCI. The genotype guided arm patients underwent testing. If they carried a loss of function allele, they received standard potent agents like ticagrelor or prasugrel. If they were wild type normal metabolizers, therapy was de-escalated to clopidogrel. Control arm, universal treatment with a potent P2Y12 inhibitor, ticagrelor or prasugrel for all patients. Primary endpoints. A non-inferiority design for net adverse clinical events, NACE, that is death, myocardial infarction, definite stent thrombosis, stroke or plateau major bleeding, and a superiority design for bleeding, plateau major and minor. The genotype guided de-escalation strategy was non-inferior to standard potent therapy for ischemic events. NACE occurred in 5.1% of the guided group versus 5.9% of the standard group. The guided strategy was superior for safety, significantly reducing plateau major and minor bleeding, 9.8% versus 12.5%. This trial solidified the concept that standardizing potent agents for everyone exposes wild type patients to unnecessary bleeding risk without added ischemic benefit. When presented together, these trials build a compelling narrative for personalized medicine in the cath lab. If the baseline is clopidogrel, genotyping identifies the 30% of patients who desperately need escalation to avoid stent thrombosis as per Taylor PCI. If the baseline is ticagrelor or prasugrel, genotyping identifies the 70% of patients who can be safely downgraded to clopidogrel to prevent major bleeding without sacrificing ischemic protection as per popular genetics trial.